Good afternoon. Today we will discuss about nasal polyps. Nasal polyps are benign inflammatory masses arising from the mucus of the nose and paranasal sinuses. These are a manifestation of chronic rhinosinusitis. Chronic inflammation of the lining of the nasal and sinus cavities results in reactive hyperplasia of the mucosal epithelium in the form of nasal polyps. And epidemiology and demographics prevalence, it affects 0.2% to 4.3% of the population. Approximately 10% of the patients with nasal polyps have asthma. Predominant age and sex, it is uh, predominant in males, that is 2:1 ratio. And genetic factors, some hypotheses and some lectures and literature suggest that there is a genetic component and a link between the association between HLA A74 genes and nasal polyps. Risk factors, 10% of the cases of nasal polyps are associated with Samter trade of asthma, aspirin sensitivity, and nasal polyps. Conditions associated with nasal polyps include asthma, cystic fibrosis, ciliary dyskinesia syndrome, allergic fungal sinusitis, and bacterial rhinosinusitis, and bronchiectasis. So let's discuss about the physical findings. Patients usually present with nasal obstruction, anosmia, watery diarrhea, and post-nasal drip. Physical examination relieves smooth and round mucosal lined masses within the nasal cavity, often arising from the middle meatus. Most often it is bilateral, that is present in both the noses. Etiology, the exact etiology is unknown or unclear, but it is thought to be multifactorial, that is multifactor contributing to the development of the disease. Cytokine and cellular inflammatory markers found to be largely involved in this case. These include T helper cells, eosinophils, and interleukin 5 cytokines. So diagnosis and differential diagnosis, possible alternative diagnosis includes encephalocele, glioma, inverted papilloma, and neoplasms. So workup of this case, diagnosis can most often be made with history and physical examination. For more unclear examination or diagnosis, anterior rhinoscopy is recommended and nasal endoscopy. On laboratory test, allergen test may be considered based on the symptoms and clinical presentation. CT sinus not essential but recommended for surgical planning if surgery is being considered. It is also important to help exclude the other diagnosis in cases of unilateral polyps. So findings suggestive of nasal polyps include lobulated cyst or masses in the nasal cavity, and partial or complete sinuses or nasal cavity opacification. And acute general prescription include medical management and surgical management. Medical management is generally the first consideration in treatment. Goals of treatment are reduction in size of nasal polyps, resulting in improvement of symptoms. Nasal corticosteroid sprays are a main stay of treatment acutely or over the long term. Short courses of oral corticosteroids are reserved for advanced cases. Antihistamines may be helpful in controlling allergic symptoms, but have very little value or effect on nasal polyps. Surgical management may be considered for those who have failed the medical therapy. The surgical removal of nasal polyps is the surgical management. It provides symptomatic relief, but it is rarely curative and it has high recurrence rate. And this is the classification of nasal polyps. These are the nasal polyps, you can see. Thank you.